METEOR is just simply a randomized phase 3 trial that actually basically evaluated the impact and the efficacy, I should say, of cabozantinib against everolimus in patients who have failed primary therapy with TKI. 600 plus patients were randomized to receive either cabozantinib, the standard dose 60 milligrams per day orally, or everolimus, again the standard dose 10 milligrams per day as well. And the primary endpoint was progression-free survival tied with a secondary endpoint of survival. The trial initially demonstrated that the PFS was a significant PFS improvement, almost double compared with everolimus from 3.5 months to around 7.6 months or so, with a hazard ratio of 0.5, which means almost a 0.51 actually, which means a 49% risk reduction of progressing when patients receive cabozantinib. The publication today from Dr. Sherry not only continue to demonstrate the progression-free improvement, but also demonstrate the survival improvement in the secondary endpoint from 16.5 months with everolimus to 21.5 or so for cabozantinib, and again a hazard ratio of 0.66, indicating a 34% risk reduction in mortality if you receive cabozantinib over everolimus. The responses to this therapy are what one would expect to see in the second line space. There were 17% patients responding to therapy by RECIST, compared with less than 5% or so patients responding to everolimus. Dr. Cherry also presented the subset analysis across many subgroups, including patients who have bone metastases, patients who have good risk, intermediate risk, and poor risk by memorial. And bottom line is, no matter what subgroup you have, it appears that treatment with cabozantinib improves outcome, not only PFS but also survival.